Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about COVID-19 and pregnancy. I'm here today with Dr. Devin Raymaker with St. Luke's Maternal Fetal Medicine. Thank you so much for joining us.
Thank you for having me.
Well, since the start of the pandemic, more than 10 million Americans have tested positive for the coronavirus. That includes tens of thousands of pregnant women. This month, the CDC added pregnancy to the list of people who are at increased risk of becoming severely ill if they get the virus. As cases in the community continue to surge, we'll be talking about expectant mothers' risk, as well as their babies, and guidance for the coming months. Well, Dr. Raymaker, as mentioned, the CDC recently added pregnant women to the list of those who are at higher risk of getting very ill if they do get COVID. Can you tell us about the recent study that led to this change?
Yeah, so it's not a study per se. There are different surveillance mechanisms that are in place to follow outcomes for pregnant women. And based on that information, what they've found is that women who develop COVID-19 have an increased risk of worse outcomes, which include ICU admission, needing mechanical ventilation or a breathing tube, and even slightly higher risk of death.
So why are pregnant women at higher risk for severe illness?
There are some unique changes that occur in pregnancy, both with the immune system and some basic, what we call physiologic changes that impact both how the heart and lungs work that can increase a mom's risk to viral respiratory illnesses.
And a study found that COVID symptoms can last much longer in pregnant women, hanging around for 2 months or more. What are we seeing locally?
So locally, thankfully, what we're seeing is that most women are having more mild symptoms and are not requiring hospitalization. That being said, there are definitely women who have been hospitalized with COVID and even women who've required ICU care and prolonged hospitalization.
Pregnant women with COVID are also more likely to deliver early. Can you tell us about that?
There's some data to suggest that delivery does occur early. Some of that was thought to be due to not necessarily what we call spontaneous preterm birth, where a mother goes into labor on their own, but medically indicated preterm birth, where there is a medical indication leading to moms delivering early.
And for expectant mothers that do test positive, is there a risk of transmission to the baby they're carrying or any other health risks for the infant?
With the data that we have so far, it is possible that the virus could be transmitted to baby, but thankfully that information suggests that that is rare and is not likely to occur. In addition to that, we don't have a lot of data about how this virus might impact the pregnancy, particularly if mom gets very sick. What we do see is that there could be an increased risk for babies not growing as well inside the womb.
Okay, so are there any additional guidelines or recommendations for pregnant mothers in particular to help protect against getting COVID?
Much like the non-pregnant population, we really recommend that moms practice prevention measures, which include social distancing, hand washing, and masking. That is of critical importance during pregnancy, again, because moms are at that increased risk to have complications related to the virus.
So is it safe to be having baby showers or attending family get-togethers with the upcoming holidays?
We would encourage mothers not to attend large social gatherings during this time. We realize that's really difficult for moms, especially as this is generally a time when there are large social gatherings, not only for the holidays, but because of their pregnancies with baby showers. But that really increases the risk of transmission. And so we encourage moms to be unique in how they approach this time in their pregnancy and use things like Zoom or other fun ways to still stay connected in a socially distant manner.
With the recent promising news of Pfizer and Moderna COVID vaccines, will it be safe for pregnant women to get the vaccine?
There's not a lot known about the vaccine right now and how it might behave in pregnancy. Unfortunately, those trials, while very promising, did not include pregnant patients. And so really the guidance about the safety and its use in pregnancy will be coming from the FDA and the CDC, and we should be following that guidance.
And what about the flu shot? Explain why it's even more important to get the flu vaccine this year.
So the flu is another respiratory viral illness, and much like the coronavirus, moms are at increased risk of having more complications, hospitalizations, and even death related to the flu. And so it's of critical importance that they protect themselves from any respiratory viral illness, including the flu. In addition, it is possible that moms could get the flu and get the coronavirus. We just don't know a lot about how these two viruses might interact with one another.
Okay, so what should pregnant women do if they do experience symptoms of COVID or the flu?
If they're experiencing symptoms, the first thing I would encourage them to do is call their obstetrician or whoever's taking care of them during pregnancy for guidance on if they need to come into the hospital, where they need to get tested, etc. That's the very first line that I would encourage moms to utilize, and that'll help them figure out where they should be going to get their care.
Great. Well, what's your final message or piece of advice to expecting families?
I would really encourage expectant families and expectant parents and moms to again practice good social distancing, hand washing, and masking to help prevent the spread of coronavirus. If you are experiencing symptoms, as I mentioned, to reach out to your healthcare provider, or if you're experiencing increased anxiety, to voice those concerns. It's really important to have open communication with your healthcare provider, and we encourage moms to do that during pregnancy.
Well, thank you so much again, Dr. Raymaker, for joining us. If you'd like to find out more about St. Luke's maternity and obstetric services, including high-risk pregnancy care and more, visit stlukeskc.org/maternity. Next week, we'll be talking to Dr. Jenny Bose, St. Luke's Health System Director of Infection Prevention, about how to protect yourself and your family as we approach Thanksgiving with in-person gatherings, travel, and more. If you have any questions for Dr. Bose, you can send us a direct message to our main Facebook page. That's at St. Luke's KC. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.